Hey everyone. I wanted to hop on here and say thank you for all of the birthday wishes that I got yesterday. My phone was flooded with text messages and phone calls and lots of really sweet messages through social media. So thank you so much. I feel so grateful to have such an amazing community of friends and family that just love on me. So yeah, yesterday I turned 40, and it was a hard birthday because I've been battling this neck issue. And I figured I probably need to get on here and share my experience with what I've been going through, because I think by sharing this, I can help other people. Justin actually encouraged me to do a vlog. So I was like, you know what, he's probably right. So anyway. So I'm going to share with you my story about how this all started and the treatment that I'm getting. And I hope that this helps some of you. So I started with, back in October, I started with weird, neurological symptoms. I started getting tinnitus or ringing in my right ear, and it just never went away. And then I started noticing that my vision in my right eye was getting blurry sometimes, and I was really sensitive to light. And I was getting these bad headaches just on this side. And I felt like there was a lot of pressure behind my right eye. And I was feeling very dizzy. So I ended up going to an urgent care, and they were like, oh, you probably have eustachian tube dysfunction, and put me on some antibiotics and steroids and said, maybe it's related to a sinus infection, try this. So I did, and I was just getting worse each day. I went to Mayo Clinic emergency room, and they did a head CT there, a CT scan, and they were like, everything looks normal. Probably just a migraine, which I've never had migraines in my life, so I thought that was really strange and wasn't the typical symptoms that, I guess you can get some of the symptoms, but not all of my symptoms were migraine related. And so I was questioning that, but they gave me a migraine cocktail and medication and said, just go home and rest and see how you feel. So I did, and again, no improvement. I continued to get worse. I started developing severe pain in the back of my neck, and the next thing you know, I felt like I could hear the vertebrae in my neck crackling and popping anytime I would move my head. And then all of a sudden it just felt like, wow, my neck muscles feel so weak, I can't even hardly hold my head up. I kept telling Justin, I feel like a bobblehead. And at this point, I was getting severe brain fog, memory, sorry, it's affecting my voice. So memory problems, unexplained anxiety. Well, probably because something was wrong with my body and I didn't have any answers. So I went to my primary care, and she was like, yeah, something seems off, but it's odd that, you didn't have any specific injury, right? And I said, well, I don't think so. I went to the theme parks and rode a bunch of roller coasters. Maybe I could have hurt myself there, but I don't ever remember any instance where I thought I hurt myself. I just remember thinking this just slowly came on, and I don't really have an explanation for it. And she said, well, maybe it was one of the roller coasters that gave you a whiplash injury or something. She said, let's do an MRI and just see what's going on there. And in the meantime, I want you to go to physical therapy. So I went to this physical therapist that was recommended by a sweet friend, and he took one look at me and said, "Oh, you have cervical instability." He knew right away that's what it was. It's called cervical instability. He said, but for most cases, we can treat this with physical therapy. You're just going to have to come twice a week. You're going to have to do a lot of exercises. It'll probably take you about 6 to 8 weeks, and you'll be feeling better. So I said, okay, great. Still did the MRI anyway. It showed a mild bulge at C5 and C6. You have 7 vertebrae, 7 cervical vertebrae in your neck, and it showed that I had a mild disc bulge at C5 and C6, but it was very mild. And I knew with my healthcare background that all the symptoms I was having couldn't be from that level of the spine, that I would have more like pain and numbness and tingling running down my arm if it was coming from C5 and C6, and I didn't have a whole lot of that. I did sometimes have numbness in this pinky finger and my ring finger, but otherwise it was really not painful or anything. But anyway, so my primary care suggested I go see a surgeon at JOI if I wasn't getting any better with PT. So I did physical therapy. I was very religious with my activities or my exercises, and went every week. And I was slowly like feeling a little bit better, but never once did I feel like normal or back to myself again. And see, this is one of the things that's happening to me. Like, I can't get my words out. I forget what I'm saying, and I get like a mental block. So you hear the birds in the background. That brings me joy. So, and then I ended up getting the flu twice, once over Thanksgiving, and then again at Christmas. And my symptoms got significantly worse, even though I was nearly done with my physical therapy program. So my friend, a sweet friend of mine who is a physical therapist, said to me, you should go talk to my friend. His name is Edsel. He's a physical therapist. He has a practice in Jacksonville. And he's such a wise man, and I think he could give you some advice. Like, maybe there's something missing here. So I did. I went to go see him at Coastal Health, Jax, and what a wonderful person he was. If you ever have any sort of like injury or physical ailment, I would highly encourage you to go to his practice. They're incredible at what they do. All of his work is evidence-based. He's done a lot of research through Mayo Clinic, and he's a very caring person too. So please, if you want more information about him, I can share it with you. Just reach out to me, or maybe I can tag his practice on this video. So anyway, I went to him, and he said, yeah, you most definitely have cervical instability. He actually like could feel the vertebrae shifting in my neck when he would palpate back here. And he was like, but I can almost guarantee you have something called Ehlers-Danlos syndrome, or EDS. There's all sorts of different types of this syndrome. It's a genetic condition. He said he thinks I have the hypermobile type, which just means like my body doesn't produce collagen the way it should, and so the ligaments and the tendons are like very thin and tissue papery. They're not strong, and there's good aspects to that, I guess. I mean, like you're pretty flexible, and a lot of the research shows that people that have EDS tend to appear younger than they are, and that they might have a higher IQ, but it can make for a painful life as you get older, just because your joints are not stable. The tissues that are supposed to hold your joints in place just become so lax. And I mean, everything from elbows, hips, knees, ankles, ribs, pelvic floor issues. As you age, this can become a problem. So he knew right away, like, I think you have this. And he said, I'm going to try to work on you a little bit, and if you're not getting any better, you need to go down to South Florida. There's a guy in Fort Myers. His name is Dr. Ross Hauser. He has a practice called Caring Medical and the Hauser Neck Clinic, and you should really think about going to see him. He does something called prolotherapy. The only issue is it's far. For me, it's not that far. A 6-hour drive is not that bad compared to some people that have to fly from all over the world to get treatment from him. And the other thing is they don't take insurance, and it can be very expensive. I feel very blessed that Justin and I have both worked so hard to save money for emergencies just like this. So I said, money's not going to be an issue, and if I need to drive down there, I will. So I did continue to see Edsel for a little bit, but I just continued to get significantly worse, like to the point where just doing basic tasks at home, like folding a load of laundry, hanging up clothes, it's exhausting, and I have to lay down a lot because I can't function. But laying down actually can weaken the spine too. So it's just like they want you to stay upright as much as possible to strengthen that spine. It's torturous, truly, like to be in pain and dizzy. And the best way they said that they could describe this is that you are carrying a 12-pound kettlebell on your head with vertebrae that are just constantly shifting, and you're trying to balance it. And you can imagine that the muscles all around there, if your ligaments are not working the way they should, the muscles are just constantly tight and spasming to support that. So it's no fun. But so I did. I applied to Caring Medical because they don't take every patient. There was a process that I had to go through where I sent all my medical records to them. I did a phone interview, and they accepted my case. I'm so grateful for that. So I went down there this week, last Monday and Tuesday, and Monday they did all these really cool like diagnostic workups. So one thing that they do is called a dynamic x-ray, digital x-ray. So it's very different than a CT scan, MRI, and any other x-ray, because it videotapes while it's x-raying while you're in movement. All of my other scans were normal and didn't show any instability because I was literally like stable. I wasn't moving. So how are you going to tell if there's any instability if you're not moving? So Dr. Hauser has this really cool x-ray thing. And so they did that. They did a bunch of ultrasounds of my jugular vein and my vagus nerve and my arteries that run through the neck. And then Tuesday I went and met with Dr. Hauser, and Tuesday morning. And he reviewed the results with me, and it did show that I have pretty severe instability of C1 through C6. But that C1 is the one that is causing the most problem. And you can literally see, like, C1 is your skull sits on C1, and then you have the C1 vertebrae, and then you have C2, and there's no disc between the two of the first two. They literally just sit on one another. And in the x-ray, you can see that when I lean to the right, my C1 literally like falls off of C2 slightly. It like hangs over like this. And then when I rotate to the left, it kind of hangs over to the left a little bit. It's just so unstable. And the vertebrae has little holes on the ends of them, and they're called foramen. And you've got your jugular vein, your vagus nerve, that run through there. And so any slight movement of my neck causes that vertebrae to shift out of place, and then all of a sudden the vein gets compressed, the nerve gets irritated or compressed, and it can start to degenerate. And so you get all sorts of symptoms with this. The vagus nerve is considered like the superhighway of the cranial nerves. It literally runs from your brain stem to like from the brain to like your stomach area. And it controls every like organ and bodily function from here down to your stomach. So it can affect your vision, because it's also connected with other nerves like your optic nerve and trigeminal nerve, and it can affect your vision, it can affect your hearing, it can affect your vocal cords, it can affect your heart rate. I've been having like palpitations and tachycardia. Like there will be times when I'm sleeping and all of a sudden I'll wake up with like my heart pounding at like 170 beats a minute. It can affect your body's ability to stabilize temperature. So I'll have like freezing cold feet and hands, but the rest of my body is like just sweating profusely. It can affect your personality. Like you can have anxiety and depression, confusion, like memory loss from all of this. And the other thing is the jugular vein that runs through there, it's supposed to help drain all the blood that is being pumped up into your brain. But if it's being compressed, it has nowhere to go. And so things get clogged up in your brain. So all that to say, my measurements from when they did the ultrasounds, my jugular vein is, when I look to the left or right, well, let me just explain to you. The normal diameter of a jugular vein when you're upright the normal diameter of a jugular vein can be anywhere from 80 to 100. And when I'm rotating left or right, mine is at 2. So it's severely compressed. And then if I look down, it closes up completely. I get no drainage of blood. My vagus nerve should be greater than, I forget what the millimeter size is, 2 point something, but mine is in the ones. So he diagnosed me with cranial cervical instability. He did confirm that I do have Ehlers-Danlos syndrome. This is another thing that happens from this like flushing. This is all connected to the vagus nerve degeneration. Which I've done this my whole life, and it makes me wonder, like, because I've had this genetic condition, like, have I been dealing with this for a long time and I just had no idea? Probably so. So anyway, yeah, he said I have the cranial cervical instability, or atlantoaxial instability is another name for it. He said I have intracranial hypertension. I have ocular hypertension. My optic nerve is being compressed by all the cerebrospinal fluid in my brain that has nowhere to go. It's just putting pressure on my eyes. My pupils are constantly dilated, and it's giving me like photosensitivity and the blurred vision. And but the amazing news is that he has this treatment called prolotherapy. It's just sugar, it's dextrose and water, and he injects it into the neck, and it's supposed to create an inflammation response. Prolo stands for proliferation. And when you inject it into the areas that are affected, it creates a lot of proliferation, and you have like cells that flood the area that are part of your like immune function, and they flood the area, and they help the body repair what's damaged. So I went ahead and proceeded with treatment on Tuesday. The treatment involves, for the neck, quite a few injections. He said I was going to get anywhere from 60 to 100 injections in my neck for that one treatment. And he said that I likely need to come back for probably 10 more times after that. But he said I have a great prognosis of recovery as long as I stick with the treatment. So I did. I got the injections, and my neck is just like, it's super stiff and very tender. But I do believe that I'm going to be healed from this. I believe that this is exactly where God led me to. It's funny because I had seen a lot of his research, Dr. Hauser's research, when I first heard about what I had going on. I started looking into it, and I started reading all of his articles that he had published, and I thought, man, maybe I should go see this guy. And then when I saw Edsel, he said, you need to go see this guy. And I thought, God is pointing me here for a reason, you know? And I'm so grateful. Dr. Hauser is such an amazing man. He's so incredibly smart, like genius smart. And he's a believer. He loves Jesus. And so during my procedure, I wasn't sedated. I had nitrous and a little bit of Xanax to help me stay calm. But I was awake, and he prayed over me and let me play worship music during the procedure. So I was really grateful to be able to do that, to get through it, because it's very painful. Literally going deep right into close to where the facet of the joint is. So that being said, my symptoms have been a little bit worse because of all of the swelling. But they said that that's a possible side effect at first, but that over time, after each treatment, I should start feeling a little bit better. I go back in 3 weeks to get another treatment done. So, but I wanted to share something with you. He wrote a book called Curing Chronic Pain with Prolotherapy. And this book is incredible. I mean, he talks about how he's healed all sorts of injuries, like hip injuries, knee, ankle. But the neck one it's incredible to me. There's not very many people in the world that know how to do this. And man, am I so fortunate that I get to be within close proximity to someone that is this knowledgeable about this, that I can go and get treatment from him. I mean, people fly. He has a map in his practice where people have pinned where they came from, and you can see pins literally from almost every continent of the world. They fly in to see this man. And I'm just blown away that I just happen to live 6 hours away from him. Yeah, so I'm very, very grateful and very hopeful for full healing. But I wanted to read to you something. He's really big into like functional medicine and, you know, taking care of your body through diet and exercise and stress reducing activities. But one of the big things that he promotes is spiritual health. And in this book, there's a chapter about why some people don't heal. And I wanted to read to you just a little excerpt from this, because I think it's really important that people need to consider this part of their health and healing. If you're going through any sort of chronic pain or chronic illness, you really need to look at the spiritual aspect of your life, and are you honoring God in this way? Ironically, I met with spiritual healers just a few weeks before going down to Dr. Hauser, and it was an incredible, amazing experience. I was able to forgive myself for any sins that I may have done, and any judgment that I may have cast upon others. And I also was able to forgive those who have sinned against me, and it just realigned my relationship with God. And I feel so just overwhelmingly thankful for that experience. And they did tell me that now that I have surrendered all of that, that I can start to work on my healing process. And then here we are now. I get this book, and it's literally what they told me. So I'm going to read to you real quick. He says, there are many causes of pain and illness, and one should not overlook the possible big picture reason for pain. It could be God's purpose for your life at this particular moment to have pain, because he wants you first and foremost to acknowledge him in your life. In Matthew 22, verses 37 through 40, Jesus replied, love the Lord your God with all your heart and with all your soul and with all your mind. This is the first and greatest commandment, and the second is like it. Love your neighbor as yourself. All the law and prophets hang on these two commandments. It could be that your healing will start the moment you restore the relationship that God desires to have with you by loving the Lord your God with all your heart, soul, mind, and strength. The second relationship that must be restored is loving your neighbor. Notice from the above verse that you cannot love your neighbor if you do not love yourself. It is not possible. For the person who is filled with God's love, it is easy to love yourself and thus love your neighbor. In Ephesians 3, verse 16 through 19, it says, I pray that out of his glorious riches he may strengthen you with power through his Spirit in your inner being, so that Christ may dwell in your hearts through faith. And I pray that you, being rooted and established in love, may have power, together with all the saints, to grasp how wide and long and high and deep is the love of Christ, and to know this love that surpasses knowledge, that you may be filled to the measure of all the fullness of God. For the person who has experienced the love and forgiveness of God through Jesus Christ, anything is bearable, even horrible, unrelenting pain. For the person who has no belief in God and does not see the higher purpose for everything in life, it is easy to see why depression and hopelessness prevail. God has a purpose for everything, and when one takes an eternal perspective, it's easy to see the many reasons it may not be God's will for your life to free you of the pain. And that just really resonated with me. Like, this whole experience has completely changed my relationship with God. I have such an abiding, deep relationship with God through this process. And I know for a fact that I'm going to be healed, and that this experience is going to give me the opportunity to share my testimony with other people. And for that, I am so grateful. So thank you for your prayers. Thank you for all the well wishes. I plan to make more videos as I progress through this treatment. It's probably going to be close to a year before I'm better, but you never know, like it could be really quick. So if there's anything that you're going through that you need prayer for, please reach out. I would love to pray for you. We're in this together. So thank you everyone for listening. The next videos that I share won't be this long because I had to give you a background of everything that happened, but I hope to actually take some pictures and videos when I'm at the clinic next time and share all that with you. Thank you guys. I hope you have a wonderful, blessed day.